Good afternoon, everyone. Thank you for joining us in this webinar. We're gonna start right away with our learning objectives. So today we're gonna want you to increase the knowledge about migratory and seasonal agricultural worker communities and the impact that national emergencies have on their health. We're going to describe what are the challenges or some challenges that these populations face during national emergencies. And we're going to also describe some effective communications or techniques or strategies to use with this population during national emergencies. So before jumping on to our content or our topics, we want to start with this question, this poll, and you can use if you have a smartphone, you can open up your camera, you can scan this QR code, or also Kevin will be sharing with you the link for this poll. And we are asking you, what emergencies have you experienced recently in the areas that you are living, or what experiences or what emergencies your population of farm workers have experienced recently in the different areas where you live. So you can go ahead and scan that QR code, and we're gonna have a a word cloud. So your responses should pop up here on this slide, and then we're gonna identify a couple of them. We're gonna take 1 or 2 minutes to see those responses. See if they pop up. All right, freeze. Okay, freeze is one of the emergencies that we have experienced so far. None. So that's good. That's great. And this is also a good exercise or webinar for you to prepare for future emergencies. We see here wildfires. Yeah, definitely. Heat distress, pesticide exposures. Let's see, the pandemic, definitely. COVID-19 pandemic, something that we still have here, it's a worldwide pandemic. What else? Fire season, tornadoes, definitely. Here in Texas, we've had a couple of tornadoes recently. That's true. Winter Arctic freezes, lack of food supplies, interesting. Very true. Gas prices, hunger. Very good. We have a lot of different emergencies, so that's really good. Wow, we have a lot of responses. I see here fires is one of the main or the common ones. Hurricanes, definitely. Wildfires, freezes, heat. So yeah, we have a couple of them. Very good. Thank you for sharing those with us, and definitely all the strategies and resources that we're going to share with you today will help kind of start preparing or creating those plans to address all of these emergencies. So thank you very much. So then let's start right away with our main topic. And I want to start giving like a background, a brief background of this population, migratory and seasonal ag workers, and the impact that the emergencies have on them. So as we know, they are exposed to many agents or many factors due to the nature of their work, but also they're exposed to different other natural disaster, such as hurricanes, like you mentioned, earthquakes, droughts, heat waves, hurricanes, or tornadoes. I mean, wildfires, the pandemic, not only the COVID-19, but other pandemics, floods, among many other. And the importance of addressing these emergencies with proper communication is to decrease or reduce the risk of any harm, any illnesses. So communicating before, during, and after an emergency can definitely help mitigate the effects or reduce the risk of accidents and health issues, or even losing their lives. So it is important to know that not everyone communicates the same way. taking in considerations that we have different populations with different characteristics and culture, etc. And some populations prefer some communication channels over others. So during this webinar, we'll be discussing what are the appropriate communication channels for this population specifically, and how can we use them to prepare for any national emergencies or disasters. So couple characteristics of migratory and seasonal ag workers. They are a unique population to the nature of their work. As I mentioned, they face particular challenges such as workplace hazards like pesticides that some of you mentioned, the use of dangerous equipment, heavy machinery, and many others. But not only that, they are also exposed to substandard living conditions, including unsafe places to live like vehicles, some of them sleeping inside their vehicles, in the outdoors, in garages, and many other substandard housing conditions. Some of them are exposed to crowded housing, poor climate control, unsafe drinking water, and mold exposure. Another factor is the social isolation due to the lack of transportation. So many of them were, a big number of farm workers live in remote areas, or their housing are in remote areas, rural areas, and they potentially work for for many months away from their families or friends. And low wages, definitely low wages, and the loss of work during an emergency can definitely affect their ability to afford utilities, their primary, access to healthcare, their primary needs. So it's definitely important to communicate with them in order to mitigate all these risks. So some characteristics about this population: approximately 2.5 million ag workers work in the United States. Some of them migrate within states following different crops and opportunities, and some of them migrate in between their countries of origin and the United States following harvest seasons. So in terms of some social demographic characteristics, the majority of them are the majority of the population are foreign born. They come from Mexico, Central America, the Caribbean, South Africa, among others. The majority of these population are Spanish speakers, or they feel more comfortable, or their primary language is Spanish. Most of the ag workers are adult men, but women also take part of in farm work. So women are also included here in this group. As I mentioned, in terms of occupational hazards, ag work is one of the most dangerous industries in the United States, according to the US Department of Labor. They work long hours with heavy machinery, hard physical labor, pesticide exposure, skin disorders, exposure to different infectious diseases, not only COVID, but also Lyme diseases from animals, and among many others. Respiratory problems, hearing and vision disorders, and musculoskeletal injuries because of the work. So communications, why communications are important with this population? Well, this population, as I mentioned, often live in rural areas where they have less access to information or communication with health providers. So they often rely on internet, the use of messaging apps like WhatsApp or Telegram. They use those smartphones if they have. Local radio stations is definitely one of the main communication channels that they use. Employers or other peers, and even visits from providers when they have a clinic or a health center, are able to take mobile units to their places. That's where they have the opportunity to communicate and receive information. So it's definitely important to address all of these needs in order to prepare them to any national disaster or a crisis. Okay, then we're gonna show. And go ahead, Caitlin.
Thanks, Alexis. Yeah, so next we're going to look at the ways that these occupational hazards and characteristics combine with national emergencies to create even more dangerous situations. So both the working conditions of farm workers that Alexis mentioned and the conditions created by emergencies can be extremely dangerous. But when these conditions are combined, they can intensify the effects. So here we're going to listen to the testimonial of Diego, who contracted COVID-19 while working on a farm in Texas. Go ahead.
Haber estado enfermo de COVID ha sido una de las experiencias más críticas y difíciles que me ha tocado soportar, y sinceramente no deseo que nadie se contagie o que se infecte de coronavirus COVID-19.
Mi nombre es Diego Sánchez, soy originario de un lugar llamado Santa Rosa, en el municipio de Iztaxoquitlán, perteneciente al veracruzano estado de Veracruz.
En el mes de agosto del año 2020 me vi en la necesidad de ir a los Estados Unidos de Norteamérica para trabajar en una granja, llevando a cabo actividades de cosecha, corte, recolección y empacado de calabazas. Las medidas de prevención en esa granja eran pues casi nulas, ya que al trabajador no se le exigía el uso adecuado de cubrebocas, ni mucho menos de algún desinfectante, gel, alcohol. Asimismo, el contratista en ningún momento proporcionó equipo de protección personal para los trabajadores que se encontraban en esa granja en el norte de Texas. Debido a la aglomeración de personas en dicho trabajo, me infecté del virus COVID-19, ya que estábamos viviendo todos en un mismo campamento y en donde hasta 6 o hasta 8 compañeros de trabajo compartíamos un mismo cuarto, una misma habitación. Asimismo, solamente disponíamos de 2 cocinas para elaborar nuestros propios alimentos, pero estas 2 cocinas tenían que dar servicio a más de 100 personas, ya que en esa área de campamento estábamos concentrados entre 140 y 170 personas aproximadamente.
Yeah, so Diego goes on to explain how he wasn't sure who or where to call, so he ended up needing to call 911 for help, and he was taken to a hospital where he was tested and treated for COVID-19. So this is an example from the pandemic we all know too well, but I wanted to use it to illustrate how some of these working and living conditions of farm workers combine with the emergencies to make them even more vulnerable. We can go to the next slide. So next we have the testimonials of strawberry pickers in Oxnard, California, who endured the Hill Fire in 2018, which burned over 4,000 acres in Ventura County. So first we hear from Santiago, who is a strawberry picker in California, and he shared that while smoke was stinging his eyes and his throat, he was actually directed to pick even faster because that same ash and smoke that was burning his eyes could ruin the produce. And I'm sure many of us, we've seen these low air quality warnings come through on our phones, right? And we're urged to stay inside. So as public health officials were warning people to stay indoors and away from the dangerous air quality, he remained bent in the field. And he also shared that no one provided any sort of protective gear. And he shared that he feels that they don't care about our health, just about the care of the strawberries. So then another farm worker, Filiberto, shared that his employer did drop off masks But because he speaks Mixteco, and the employer did not speak Mixteco, he couldn't understand what was being said. So he wasn't sure if he was allowed to take one, and he ended up trying to use a bandana to cover his nose and mouth. So you can go to the next slide. So after listening to these testimonials, do you think that improved emergency response communication could have helped to avoid these adverse health outcomes? And how? How could employers and health centers have communicated differently, or other community partners, how could they have communicated differently to potentially avoid some of these adverse health outcomes? Go ahead and share your thoughts in the chat. And I'll give everyone just a minute to think about and to respond to this question. So Julie shared, communication in Indigenous languages is essential. There's a misunderstanding that ag workers all speak Spanish. Yeah, exactly. So we're gonna get to some tips and strategies in just a little bit, but that was one of the reasons why we thought it was so important to go over some ag worker characteristics, because there is so much diversity among farm worker communities. Jamie shared that they agree with Julie. Yeah, so if you are interested in communication with Indigenous farm workers, we do have a couple of resources that we'll get to a little bit later on that as well. Are there any other communication strategies that could have been used to avoid some of these outcomes? Yeah, so Kimberly shared the use of pictures to provide instructions, right? So luckily, many images can be a language that many people can understand, right? Regardless of literacy level, native language. So using outreach materials or warnings that include pictures with simple instructions can be a really powerful way to avoid some of these outcomes. Exactly. Some people use their cell phone through Google to help with communication, right? Maybe not the case in some Indigenous languages, but it can definitely be a last resort when a translator can't be found. And Casey shared, maybe with the emergency response warnings to provide links to who to contact with abuses from employers. Right, so in some of these cases, it might even be, like in the case of the California fire, a lot of these employers actually got exemptions so that their employees, their farm workers were allowed to stay in the field, but that might not clear up issues like the lack of paid time off, right? A lot of these workers don't have that paid time off. So maybe advocating for some of those employment issues as well. Definitely a whole picture approach. I like that. Yeah. Okay, so I think we can go on to the next slide. So here we see that it really takes all of these elements together, the occupational hazards, the emergencies, and the communication challenges to come together to produce adverse health outcomes that we see here. The good news is that improving even just one of these elements, and in this case, we're focusing on emergency response communication with farm workers, we can see health risks better mitigated for this population. So in the case of, on the top, for example, a heat wave, right? We have the occupational hazards of and living hazards of substandard housing with no air conditioning, as well as a lack of heat safety protocols in the industry. You combine that with an extreme heat event, which is the emergency, and a failure on the part of emergency broadcast to use proper channels for migrant and seasonal agriculture workers. And we see the result of an increased risk of heat stroke with lack of appropriate action. So each of those events were necessary to create this negative outcome. So even by using better channels for migrant and seasonal agricultural workers, we might have been able to improve that outcome, right? Same thing with the pandemic, an example that we've all seen over the past couple of years. Farm workers experience a close proximity to others during their work and leisure time. You combine that with a disease outbreak and a lack of culturally responsive outreach materials, and we see that migrant and seasonal agricultural workers had worse disease outcomes with COVID-19. So again, here we're targeting that lack of culturally responsive outreach materials to improve that or mitigate that risk. Next slide. So why is it so hard to have clear, consistent communication with farm workers during national emergencies? Well, for one, many farm workers live and work in very rural areas where there's poor internet access and cell phone service. I'm sure if you've ever done outreach to farm worker work sites or camps, you may have noticed that you didn't have great cell phone service. Well, that is an issue that can affect farm workers all the time, not just on one outreach date, right? And that is included even in an emergency. It can definitely complicate receiving messages. Another factor is the limited transportation that migrant and seasonal agriculture workers face. Again, these rural locations, they usually don't have any sort of public transit. So if a farm worker doesn't have their own transportation, they sometimes rely on their employer to get them into town, to a grocery store, or to see the doctor, or for other vital needs. So that can absolutely complicate and become complicated during an emergency when they might not have the ability to flee or to go see a doctor or to get to a shelter. Another is, I'm sure you're all keeping track of the contact information of the people you serve. But if farm workers are migrating from one location to another, as they often do, you might not have up-to-date information for where you can find farm workers. Their addresses might change often, or even their phone numbers, especially if they're migrating yearly from outside of the country. And this is why choosing appropriate communication tools is so important, which Alexis will cover in just a little bit. Next slide. So I'm curious, why clearly everyone here felt that it was important to prepare for emergencies with migrant and seasonal agriculture workers, but what is your why? Why do you feel that it's important to prepare for emergencies with these communities? Go ahead and share in the chat any ideas you might have. We have a couple here, but Casey said due to changing climate patterns. Exactly, right? So farm workers are exposed to the elements nearly all the time due to the nature of their work. And because we see more frequent and more drastic climate events, that's absolutely going to impact them on a higher basis, which is why we need to prepare even better. Great thought, Casey. Flor said, they often have less of an opportunity to prepare for climate emergencies, and it is crucial to educate them on preparedness. Right, so I don't know about you, but I can't imagine if I worked a 14-hour day where I would find the time to put together an emergency kit or to discuss emergency planning with my family. Same thing with low wages, right? Like preparing some sort of kit, or even finding transportation out of the area where you live, all that can cost money. And if you're making really low wages, that could be really difficult. Dale said, because they're so often forgotten by the general public, right? Unfortunately, farm workers oftentimes are in such rural areas, they're sometimes it's kind of out of sight, out of mind, right? It's not a population that you might generally interact with if you don't purposefully do so. So it's important that they're not forgotten during an emergency. Kimberly said it's the right thing to do. Exactly. Yes, exactly, Flor, and less resources to prepare those emergency kits or preparing their homes. So other ideas that we thought of is equity, right? We so often see poor outcomes for farm worker communities as compared to even other Hispanic populations or the general population. So it's an important piece of equity to try to make up for those inequitable outcomes that they so often face. Another reason might be we keep having all of these recurring emergencies, so why not learn from them so that we can serve our communities better in the future? Oh, Jennifer said farm workers provide the often visible labor that we depend on for the food on our plates, and the families of farm workers are depending on them as well. Yeah, so that's so true. I mean, I think we all saw this during the pandemic. Although farm workers are often forgotten, we rely on farm workers to keep us alive as well during an emergency. Yeah. Go ahead. Okay. So next we're going to transition into how do we actually create these high quality emergency communications. So we've looked at population characteristics of migrant and seasonal agriculture workers. We've talked about why it's so important to prepare with agricultural workers, and now we're going to dig into the how. Go ahead, next slide. So we use the CIRC rhythm to craft messages for migrant and seasonal agriculture workers. CIRC stands for Crisis and Emergency Response Communication. And it's broken down into 4 steps. Preparation, so that's what you do before an emergency has even started. Initial, which is actually when that event starts to happen. Maintenance, which is as you're going through and kind of following up while the event is still going on. And then resolution is when it has been concluded and you're trying to work on lessons learned. Next slide. So the crisis and emergency response communication rhythm is a tool for high quality communications. It's developed by the Centers for Disease Control and Prevention, also known as the CDC, to prepare messages for an emergency. And it's meant to be done before the emergency starts. That's very important in this process. And it's designed to prompt action from your desired audience. In this case, we actually adapted the CIRC rhythm to migrant and seasonal agriculture workers specifically. Go ahead, next slide.
So let's start then with the first step of the CIRC rhythm, preparation. And this is the stage when you want to build a relationship with your patient population. You can also invite community leaders or representatives from the ag worker communities to participate in that process of planning for communication planning. And this should occur before the emergency takes place, as Caitlin mentioned, and it should be done, with different partnerships within your target population and other advocates. So they have 3 different concepts or 3 different steps under this first topic. So the first one will be draft and test messages with different populations to make sure that this information or the information that you want to share is understandable and also is actionable in the moment of crisis. So you would want to design these communications depending on what type of emergency you are facing. Not all the emergencies are the same, so not all the emergencies are, or you respond in the same way to this emergency. So you want to create a concise, simple, and in plain language communications or messages. You will always want to promote action. You want your population to take action towards those emergencies or towards preparing for those emergencies. And something very important is that you want to test those messages with your population. So you can either try these messages or pilot test these messages with all the population, but you can also select a sample. You can take different individuals from different subgroups within the community or the population, and you can share these messages with them in order to receive feedback. So in second place, we have develop partnerships. So obviously it's different. That's very important to develop partnerships and build relationship with organizations and community stakeholders like local health authorities, public health departments, emergency responders, schools, faith-based organizations, food pantries, grocery stores, local hospitals, among many others that you can expect they can work with you in the response of any of these emergencies. So you also will like to engage with the leaders of you, as I mentioned, in order to create this partnership, but also connect with those emergency response representatives. And you would like to coordinate appropriate response according to the type of emergency. What are the steps towards those different emergencies? And lastly, we would like to create a crisis communication plan using all the components above and the additional information described in in the different plans where you would like to create this communication plan. And the first step will be to select and train a spokesperson. You would like to select groups of your organization, but also from your partners that are, kind of properly deliver, that are trusted from within the community. And in order to create this plan, you would like to start exploring where the population receive information, what are the different channels that they use, what type of information they access or they consume. So then you will select what are the appropriate media channels to reach the ad workers. And this could be radio, it could be TV, it could be different social media. They use different apps, as we mentioned before, WhatsApp, Facebook, Twitter, among many others. Or also, if you want to if this population, for example, prefers in-person workshops, you could create this community workshops in order to deliver all of these different communication strategies.
So moving down the circ rhythm into our next step, we have initial. So you've prepared for your emergency, you've drafted and tested your messages, and now is when you get that tornado warning or you see the hurricane in the forecast. And these are some steps that you need to immediately take when you activate your emergency communication plan. So the first is you need to express empathy. And that is because emergency messages are better received when you validate the population's feelings and you build trust. So health center outreach staff or community health workers who are familiar with their community may understand those fears and feelings of the population to promote greater action. In an ideal case, those CHWs would actually be from the community they serve. But just, even if they're not basically having this constant contact with the target population, may give them a better sense of the fears that are out there. So you're going to want to work with your CHWs as part of your team to express empathy and validate those fears. Then you want to explain risks. So by explaining any relevant risks, you can let migrant and seasonal agriculture workers know why they need to take the steps you are recommending. So we all know this population does experience additional risks. For example, any environmental disaster is going to affect farm workers who work outside more severely due to their exposure to the elements. So including that in your explanation of the risks, right? Like there's a hurricane coming, there's a heat wave coming, and you have a greater risk due to that. then you want to promote action. So now that farm workers understand the why, you want to give simple, actionable steps that they can take to mitigate that risk. So what are the most important steps farm workers should take that they have the ability to take that will most mitigate risks? So just remember that they need to be appropriate. So recommending steps like drive to your nearest shelter or call this emergency number, which only has services in English, may not be the best option for farm workers, right? So the directives you give will depend on the resources available to farm workers. And this is where those partnerships that Alexis was mentioning that you built before the emergency can be so important. If you build effective partnerships to address these anticipated needs, you can promote positive actions that are appropriate for farm workers. So drive to your nearest shelter turns into call this number for transportation to a shelter, and the line is available in Spanish and Mixteco, right? That's a much better set of actions to promote. Next slide.
So we pass then to our third step, and it's maintenance. So these steps ensure that the community understands what's going on and what are the risks, and also what are the actions that they can take in order to reduce these risks or any harm. So it is important that the community remain vigilant, and this is when we are involving the community. And it's important also for them to care for themselves and to others, you know, extend their hand with your neighbor, with your community, and help in preparation, but also in the recovery efforts. So when there are gaps in information, people may start speculating, or you know, they won't have the exact or the appropriate information. So it's important for you to remind the community that your organization is working with them in order to provide the appropriate or the trusted information. So help people understand what are the risks of each of these emergencies and address any source of misinformation. So us as health providers, health centers, and other farm worker advocates, it is important for us to stay up or stay on top of any updates. And we can relate, or you know, as we remember when the pandemic started, the COVID-19 pandemic, we started receiving a lot of information from Facebook groups, from CDC, but also in the news, in the newspaper. We had so many different sources of information that at some point we said like, whoa, I don't know which one, you know, which is the most appropriate or the most trusted source of information. So it is very important for us as healthcare providers to access those trusted information, then share that information within the community. So during this maintenance phase, we need to work to answer questions like, has this happened before? Has this emergency happened before? How can we prepare if this happens again? Or if this happens sometime? How long will it take for the community to recover? So we need to start brainstorming about what could happen in the future and how could we take actions toward it. So so we divide this step into two phases or two main concepts. We want to segment the audiences. So we want to explain the different risks that exist among the ag worker population. As the emergency progresses, you may see that there are parts of your audience or your community that require different types of measures or different ways of communicating. For example, if you need to address any special circumstances or any special information of this crisis, and you have children, you have elder, you have indigenous populations or groups within this big population, you need to make sure that this plan addresses all the needs of information towards them. Always encourage public support and cooperation within your community in response, you know, to any of these crises or the recovery efforts, as I mentioned before. And it's very important during the emergency and after the emergency, encourage people to keep checking up to those who live, you know, within their community. And on the other side, we have addressing any rumors, any misinformation, or any unclear facts. So it is important for us as providers to track social media or any news media channels, public comments, or any statements that we can identify that could be rumors instead of trusted information, and try to resolve those misunderstandings. If we see like, or we hear about, you know, that any kind of substandard housing is safe, or if they receive information, they share information that no, we should stay inside our houses. No, because they don't. Not everyone has the same housing opportunity. So some of them might need to move out to a shelter, among many other examples. So it's very important to be aware of what information is being shared within the community and try to address that. Important always to clarify any messages and keep the information accurate.
Okay. So we prepared for our emergency, right? We have sent out our initial messages, our initial communications. We've maintained that message, addressed any rumors, right? Followed up. And now the emergency has largely passed. We're mostly out of the danger, and you're kind of in the cleanup and rebuilding phase. So this is where the resolution of the CIRC rhythm happens. And I know it might sound exhausting when you're just cleaning up from your last emergency, but we want to start thinking towards the next emergency. As we know, emergencies are happening more and more often, and at times they might even overlap. So during the resolution phase, a couple steps that you want to take are promoting preparedness within your community for future emergencies. That's what we're all doing here, right? We've all had this shared experience of living through a historic crisis, the COVID-19 pandemic. So why not learn from that experience to prepare better for the next emergency? So you can take that advantage of the attention brought to emergency preparedness in the wake of that crisis, and you can use that energy and attention to drive the preparation process forward. So you're going to want to discuss lessons learned. So here you're looking to promote continuous improvement in your plans. And you can ask yourself and your emergency planning committee questions like, did farm workers face negative impacts despite our communication plans and recommendations? Or, for example, were communications received poorly, or did they miss their desired intent? And when you evaluate questions like these, they may reveal the areas for improvement for your next emergency and also increase the cultural literacy and impact of your communications. And then you want to revise your plan, right? So you want to regroup all those community members, farm worker leaders, everyone who was involved, and revise your emergency response plan. And you might even consider re-engaging agricultural workers or maybe other community members who were unwilling to take part in that planning process before the emergency, because they might see that if their workers or if members of the community were impacted in the emergency, they might have a renewed or a shared interest in doing better to reach that workforce more quickly during the next emergency and keep them safe. So this brings us to the conclusion of the CIRC rhythm, and I'm going to pass it back to Alexis to dig into some of the potential messaging strategies.
So here I'm sharing with you two examples from adcouncil.org and ready.gov. These are two great sources of information. They share different emergency preparedness videos, mostly in English, but some of them are in Spanish. And I'm going to share these two short clips that they use to promote emergency preparedness.
¿Qué tan preparada estaría tu familia si un tornado llamara a tu puerta? O una inundación, o un huracán. No puedes desaparecer un desastre natural. Por eso es importante ir ahora a listo.gov. Tienen las herramientas y consejos que necesitas para hacer un plan de emergencia con tu familia. Así que si el desastre llama,
Vamos.
estarás listo para proteger a tu familia.
Ay, solo la pizza.
Haz un plan hoy.
So as you saw in this short clip, there are many strategies included in just 30 seconds. So as you saw, they use visual elements and audio. In this case, it was Spanish because it was targeted to as an Hispanic population. So they use these elements in order for them to feel identified. They use, for example, on this one, use of animations or cartoons, probably for more young groups or younger population. They insert cues to action. They were promoting what to do, create your plan, have your kid, take care of your pets. So it's important also that, show or include those cues to action with important information about any of these emergencies that they can be or they can face. And they also shared where can you look for more information. They shared a link to a website where you could, include all the information related to emergencies. So that was one of the techniques. And I'm going to share this other short clip, and we're going to discuss it too.
Severe weather can strike anytime, anywhere, but there's a simple way to stay safe. Hey, Jim Cantori here. I stay safe in dangerous weather by planning ahead. You can stay safe too with a few easy steps. Build an inexpensive kit with supplies for your family's needs. Write down important information like phone numbers and medications. Always talk with your family and remember any pets in your planning. Be ready, be safe. Start your plan today at ready.gov/plan.
So on this side or this video, you saw that there were use of real images and videos to impact or create an impact of these emergencies. You can also feature community leaders or people who are or the community look up to. So as key individuals who can share a message of preparedness and have an impact on the population. And also use some cultural elements such as music, images, among many others. So you saw here two different strategies. You can also, when we send the follow email with the presentation, you can access those two links and you will see a lot of different examples that you can take as example to target or to tailor messages, depending on which emergencies are more frequent in your areas. So here we have three examples developed by CDC. Also there we're sharing another link where you can find all of them. There are over 20 different templates and tools, but I wanted to showcase these three. The CERC programs from CDC, they created or they draw this, they created these templates and tools from lessons learned during past public health emergencies and doing some other research. So the first one we see on the left side, it's called the Special Population Assessment Tool. And this tool helps identifying groups of individuals who require different messages from the general public information. So this is more to target those subgroups within your population. And this is targeted to those who cannot be reached through mass communication channels. So when you are doing this assessment, you would like to consult individuals within the population or any representatives from different organizations and clarify how the population may receive the information more frequently during emergencies. And this also allow the population to kind of like take a part in the process of communication, because we want, one thing is us approaching to the community and giving these tools, but there's another important part. We need to hear from the community, like, yes, we like this method, or we don't use these methods of communication. This is the one that we use. So that's another big important part of. So you can also access these tool. It's just like 6 pages, and you can, use it to tailor your messages and also get to know your community. In the middle, we have the first 48 hours checklist. This is a checklist that helps prepare health centers or other organizations to prepare 48 hours before a national emergency, getting in contact with designated spokespersons, designated staff, or persons who are acting upon the emergencies, and connect any emergency operations centers to provide tips on how properly deliver messages to this population. And the third one we have on the right side is the message development for communication. This is another tool or these resources help tailor emergency communications according to the audience and the purpose of the message and which channels should be used. So it also helps to create cues to action, as we have mentioned before, and the use of any other trusted information references or sources. So we invite you to access these 3 and also all the other tools included in the link below when we share this information, and all of these tools will become definitely in handy, very helpful to create those plans that we have been sharing with you or mentioning.
So I know we've discussed a lot today in a short amount of time. So if you'd like to reference any of this material in a short, easy to digest format, we also have a tip sheet for effective communication with migrant and seasonal agriculture workers during national emergencies. And this is a really easy reference guide to many of the items that we discussed today, including MSAW characteristics, communication challenges to evaluate while making your plans. And it breaks down the simple steps to creating high quality emergency communications with farm workers. It also has links to a lot of the helpful tools we're going over today. And this tool is available in English and Spanish and can be a good reference to look at while you are drafting your communication plans with your team. I also noticed that some of you in the registration form on Zoom expressed needs about communicating with Indigenous workers. And we do also have a tool on effective communication with Indigenous populations during national emergencies, as well as an accompanying webinar on communicating with Indigenous populations, which we'll share in the follow-up email to this webinar. And I see Casey's question about where this tip sheet is located. I can drop a link in the chat, but we will also be sharing all of these resources and files after the webinar. Go ahead, next slide. We also have an agricultural worker fact sheet from NCFH if you'd like to learn more about ag workers, their demographics, wages, housing, health, and other important facts. And we're also sharing the CIRC Hub, which is where you can learn more about crisis and emergency risk communication and the many tools available, including the CIRC Messages and Audiences Guide, which details how the right message from the right person can truly save lives during an emergency. Next slide.
NCFH also take a big part in social media and radio resources. We have COVID-19, we have partnered with Radio Bilingüe and the Hispanic Communication Network to create some radio PSAs. In this case, most of them are related to the COVID-19 pandemic, but we also kind of like share information on how to tailor these messages or create these radio PSAs for any other emergency. And I want to share real quick this 30-second clip, or I think this one is 1 minute. And this one is about that COVID-19 vaccination card.
Tu retratito lo traigo en mi cartera.
¿Por qué tan contenta, abuelita?
Me acabo de poner mi dosis de refuerzo contra el COVID y mira, quedó apuntada en mi tarjeta de vacunación.
Muy bien, abue. Pero tengo una idea. Le tomo una foto con mi celular, se la mando a toda la familia. Si se pierde, ya sabemos dónde está.
¡Buena idea! ¡Hola! Por algo eres mi nieto favorito.
A la hora de vacunarte, debes recibir una tarjeta de registro de vacunación que indique qué vacuna contra el COVID-19 recibiste, la fecha y el lugar. Conserva tu tarjeta de registro de vacunación COVID-19 para uso futuro y, si puedes, tómale una foto como copia de respaldo. Si no la recibiste o la perdiste, comunícate con el Departamento de Salud donde te vacunaste o nosotros te ayudamos. Si tienes preguntas, comunícate con el Centro Nacional para la Salud de los Trabajadores Agrícolas vía Facebook o Instagram con la frase Una voz para la salud. Un mensaje del Centro Nacional de Salud para los Trabajadores Agrícolas y esta estación.
So in this one, this is a great example, again, how to use radio messages to include cultural characteristics, targeted messages about type of emergency, in this case was COVID-19, and how to save your vaccination card in order to, save it or to show it in case you need to. It also shares who to reach out if you want more information, et cetera, et cetera. So this is a great example on how can you create short messages in order to showcase or promote these audio messages in different local radio stations. And we have some other tools here. NCFH has developed 2 social media toolkits that you can use. The first one is the COVID-19 messaging social media toolkit. And although most of these resources are directed to or related to COVID-19, all of them can be targeted or can be adapted, to other emergencies like fires, tornadoes, hurricanes, etc. It's the same kind of concepts, but just changing what kind of emergency you are facing. We also have training and resources. Again, most of them are for COVID-19, but they can be also adapted. They are available in Spanish, Mexican, and Central America indigenous languages, and also Haitian and Creole. So you definitely want to share out or check out the link below where you can find all of these resources in English, Spanish, and also indigenous languages. And we have a farm worker committee. This farm worker committee is a partnership that NCFH has created with a group of farm workers from West, East, from the US, Mexico, Honduras, and other places in the United States too. And they are a group of different farm workers, or they represent different groups within the farm worker community that revise many of these resources that NCFH develop, and they give feedback on how if it works, what kind of messages, what kind of words they should change in order to have a better impact in their population. So this is another good strategy that you can use. Create a small group of farm workers from your places or your areas, and they can also work with you to revise these resources. And last but not least, we have the Emergency Preparedness Toolkit for community-based organizations. You can also access this in the follow-up email, and this is a resource or a guide developed by Bloomington Public Health in collaboration with Minneapolis-St. Paul Metropolitan Medical Response System. This is a program that supports the integration of emergency management, but also health and any other medical systems that you may have or your health center have in order to have a coordinated response in case of any of these, big crises, emergencies, and how to reduce the consequences of any of these emergencies. So with this, we thank you. This is the end of this webinar. Again, we thank you for joining us.